Hi,
Hi.
my name's Emily. I'm a student nurse with Muskegon Community College. How are you?
Good, how are you?
Good. Today we're going to be doing a full head-to-toe assessment. It's going to take about 30 to 40 minutes. I washed my hands when I entered the room, and I checked for adequate lighting. Before we get started, I want to stress confidentiality. Everything we talk about today is going to be between you and your health team. Do you have any questions or any needs before we get started?
No.
Okay. I'm going to just check your wristband, and if you can tell me your first, last name, date of birth.
Liz Sathry Whitman, 4488.
Okay. I'm going to ask a series of questions.
Okay.
I need you to just read the sentence, just get that one out of the way.
The sky is blue.
Okay, thank you. I'm going to list a series of numbers, if you could repeat them back to me. 2, 11, 10, 15.
2, 11, 10, 15.
All right. And what would you do if you were on fire?
Stop, drop, and roll.
Okay. And who is the president?
Trump.
All right. Do you know where you are today?
The doctor's office.
Do you know what month it is?
March.
Great. Patient's general survey is she is a well-groomed young female. She's Caucasian. Her dress is appropriate for weather, and she knows where she is, and she knows her birthday, so her name and date of birth, so her short and long-term memory are intact. She was able to answer judgment and knowledge questions appropriately on alert and oriented ×4. So we're going to just kind of start from the top and work our way down. If you could just take your hair out of your ponytail for me. I'm going to put some gloves on.
Okay.
I am going to just look first, looking for size, shape, and symmetry. I'm looking at the hair. Her hair is smooth, shiny, clean. I'm going to look at the scalp. I put gloves on. Scalp is not dry. It's white, free of parasites, no lesions. I'm going to palpate. If you feel any pain, let me know. No pain? Okay. Go ahead and clench your jaw for me. Can you smile for me? Can you frown? Great.
Hey, get back here.
I'm going to check for,
Come here.
see if you're dehydrated.
Yeah.
Patient's head was symmetrical and even throughout. There was no pain noted upon palpation. There were no parasites noted. Her hair was clean. Her smile and frown indicates that cranial nerve 7 is intact. Her temporal pulses were +2 bilaterally. Her cranial nerve 5 is intact, as evidenced by able to feel the clench of her jaw. No tenting during chest tuber. So I'm going to take a look at your ears next, so if you want to put your hair back up, that's fine. So I'm just going to look first. Okay, are you having any pain in your ears?
Mm-mm.
I'm going to touch your ears. I'm going to look inside. I'm going to do what's called a whisper test. So I'm going to just stand behind you. I'm going to say a couple words. I just need you to repeat them back to me.
Okay. Blue. Orange.
Great. Patient's ears were symmetrical and even, no redness noted, no diaphoresis, no drainage upon looking into the ear canal. Her ear canal was pink. She was able to pass her whisper test, so cranial nerve 8 is intact. So next is your eyes. So we're just going to kind of do a bunch of stuff here. So right now I just need you to look at me, but before we do that, I'm going to check your pupil sizes. 6, All right. So just bright light, I'm sorry. I'm going to put my hand on your face. Okay, follow my pen. Keep looking at my pen, okay? Good job. Can you pull down on your eyelids like this? Okay. I first assessed and inspected for size, shape, and symmetry of the eyes, which were even. Her sclera is white and moist. Her corneas that I looked at with the side of my light were clear and intact. Her irises are brown and even. She was able to have extraocular eye movement with cranial nerves 3, 4, and 6, so that's all intact. She was PERLA, with pupils equal, round, reactive. Pupils were 6 millimeters, and accommodating. So cranial nerve 3 is intact, as evidenced by that. We would also normally do a visual acuity with a Snellen chart to test the cranial nerve 2. The way that we would do that is have the patient stand 20 feet away from the chart with both eyes open, read the lowest line that she can, then cover each eye. And that's what we're comparing is at 20 feet how she compares with the rest of the general population. I'm going to look at your nose.
Okay.
So we can, do you have any pain in your nose or anywhere in your face?
No.
Okay. I am going to touch your face now. I put clean gloves on. Any pain?
Mm-mm.
Pain?
Mm-mm.
Okay, so can you take one finger, plug your nostril, and sniff? Other side, please. And I'm going to, with my light, I'm going to shine, so if you can kind of touch your nose. Okay, good job. Patient's nose showed no physical signs of deformity or swelling. Her nose was patent. Nasal mucosa was clear. She was free of drainage. No pain in the maxillary or frontal sinuses. So I'm going to take a look at your mouth.
Okay.
So I'm just going to have this so I can take a really good look around.
Okay.
Open up wide. I'm going to... Can you lift up your tongue? You move it side to side. Can you say ah?
Ah.
Let me just throw this away a second. Washing my hands. All right, so upon inspection of her mouth, the lips were moist, not chapped. Everything was symmetrical. Upon looking inside the mouth, her buccal mucosa was pink and moist, free of lesions. The floor of her mouth was highly vascular and also free of lesions. Palates were pink and moist as well. Tongue was rough on the surface and smooth on the sides. Teeth were free of obvious caries and plaque. Patient was able to say ah. Cranial nerve 10 is intact. To elicit a gag reflex, I would have taken my tongue depressor and pressed on the posterior part of her tongue to test cranial nerve 9. The movement of the tongue indicates that cranial nerve 12 was intact. Excuse me, I'm washing my hands. So I'm going to look at your neck. Okay, I'm going to feel your neck. Okay. Trachea is midline. Can you show your shoulders? And we're going to do some range of motion, so kind of tilt your head to each side front and back. Kind of just rotate all around for me. Great. I'm going to check your lymph nodes now.
Okay.
So just tell me if there's any pain. Pre-auricle, posterior auricle, occipital, posterior cervical, anterior cervical, tonsillary, submandibular, submental, supraclavicular. I'm going to check your carotid. Patient's neck was symmetrical throughout. Her trachea was at the midline. No lymphedema noted upon any of her lymph nodes. Cranial nerve 11 was intact, as evidenced by ability to shrug shoulders. Carotid artery was 2+ bounding. The reason I only did one at a time was so we don't stimulate those baroreceptors. We're going to look at the arms now. So I'm just taking a look. I'm looking at all of your joints, muscles, everything specifically. Do you have any tenderness anywhere in your arms?
Mm-mm.
Okay, so I am going to feel your arms. I'm taking special note of all the major muscles and joints, all the way down to the wrist and fingers. I'm going to check your brachial pulse. Radial pulse. Ulnar pulse. Can you squeeze my fingers, please? Can you push my hands away? Can you pull them towards you? So we're going to do kind of full range of motion again. Sorry, I keep sniffling.
Okay.
I was hidden. There we go. Lift your arms up. Down. And lift your arms up. Can you take your arm and reach for the opposite shoulder? Both sides. Good job. And full circle. And I think we did out in already. Okay, just making sure. I'm going to check your capillary refills within 3 seconds, and we're going to do some hand motions too. And then extend your fingers, pull them tight, clench your, perfect. And if you could take your fingers and touch each of them. Good job. Both extremities bilaterally the skin was warm and dry. There was no pain or tenderness noted upon palpation in the major muscles or joints. No inflammation or warmth at the muscles or joints. Hand grips were strong and equal bilaterally along with push-pulls. Full range of motion. She was able to extend her arms, hyperextend, rotate, abduct, and adduct. Pulses, radial, and ulnar were +2 bilaterally. Capillary refill time was within 3 seconds, which I said already. But we're going to look at your lungs now. So do you have any pain in your chest wall or here?
Mm-mm.
So I'm going to palpate before I do all my listening. Any pain?
Mm-mm.
Okay. So I am going to just put my hands here at T10. Can you breathe in? Good job. And every time you feel this, I want you to say 99.
99, 99, 99.
Good job. I'm looking at AP transverse. Sorry, shocked you. So there's a lot of listening, so if at any point you need me to take a break, let me know.
Okay.
Breathe in. I'm gonna go under the shirt. I'm gonna listen to the sides. We're almost done, just gonna listen to the back. Okay, thank you. Patient's breathing was at a nice rate. She was not labored. She was not breathing shallow or too deep. Lung sounds were equal throughout, front, anterior, laterally, and posteriorly clear. Upon inspection and palpation, there was no pain. She had 2-to-1 ratio for her AP transverse. Tactile firmness was appropriate as vibrations got softer towards the bases. Chest expansion at T10 was bilateral. Okay, if you want to lay down for me. Okay, so I'm going to actually listen to your heart first, but thank you. Okay. So the 4 listening points of the heart are the aortic at the right second intercostal space, about a third of the way in, and then pulmonic, second intercostal space on the left. Erb's point is the third intercostal space. Tricuspid is the 4th intercostal space. And then the 5th intercostal space is at the midclavicular line is mitral. That is also where we'll be taking our apical pulse and where point of maximal impulse is. So I'm going to listen with both sides of my stethoscope. We're hoping to hear S1 sounds louder in the aortic and pulmonic, and S1 sounds louder in the tricuspid and mitral. All right, I am going to go under your shirt, and I am going to be taking your pulse for about a minute.
Okay.
So just go ahead and lie normally. Thank you. You can cover up. Apical pulse was 84. No arrhythmias noted. Okay, so I'm going to look at your belly, but before we get started, are you having any pain in your stomach? Okay, so if you can just pull up your shirt. I'm going to look at your stomach. Okay. I'm going to listen. Feel your belly. Any pain?
Mm-mm.
Okay. There were more than 5 vowel sounds in all 4 quadrants. I am going to go back and listen to her heart again with my diaphragm because I did not do that before. I'm sorry, one more time. Thank you. The diaphragm is a tool that you can use to check for murmurs or any lower pitch sounds. No murmurs noted. Okay, we're going to look at the lower extremities next. Have you had any pain in any part of your lower extremities? How about
No.
specifically your calf?
No.
Okay, I'm going to look at the major muscle groups and you're going to feel me touch. Feeling for popliteal pulses. Okay. Can you move your feet towards you and down? Can you wiggle your toes? Can you flex your toes? Can you curl your toes? Great. I'm going to have you push against my hands and then pull towards your nose. Good job. Checking the pulses. Upon inspection of the lower limbs, there was no visible signs of any deformities or irregularities. They were bilaterally equal. There was no pain in the calves, no redness in the calves. The 3 pulse points here that we are checking are in the inguinal region for the femoral pulse, popliteal, or 4 places, dorsal pedalis, and tibial pulses. Those were strong, +2 bilaterally. And the major muscle groups and joints were free of tenderness upon palpation, warmth, and inflammation. Skin was warm and dry to the touch. Range of motion of the feet was intact. She was able to flex, extend, curl her toes. She was able to rotate her ankles. Capillary refill was within 3 seconds. And we're going to do our pain sensation test. There is a sharp side and a dull side to this. I'm going to just put it on your hand so you can feel the difference. Okay. With your eyes closed, I'm going to touch several points and I just need you to tell me which is sharp and which is dull.
Okay. Sharp. Dull. Dull. Sharp. Sharp. Dull. well.
Great. Sensation to pain and stimulation is appropriate. She passed, and her push-pulls were strong and equal bilaterally. All right. A couple more things, and then we're all done. So if you want to sit here at the edge of the bed for me. First, actually, I'm sorry, we're going to check your gait. And if you can just walk from here to the edge of the wall, and then you can just stand kind of here at the bedside. Great. So I'll just kind of have you face this way for me. I'm going to have you close your eyes. Okay. And then if you can bend forward, if I've left you enough room, I'm going to feel your spine. Okay, thank you. You can stand back up. We're going to do, I don't know if we have enough room there. We might have to have you step out. There you go. I'm going to have you do a series of movements. You can just follow me. So first we're going to check your spine. So kind of rotate. And we've already showed extension, and we need to show hyperextension. Good. And then can you go side to side? Perfect. So we're going to do some leg checks too. So if you can lift each knee. And if you can adduct each side. Perfect. And we've lifted, we've moved, we've checked the feet already. Can you rotate? Okay. And then if you could put your arms in front of you and close your eyes. Okay, great job. You can have a seat. Patient's gait was steady. She was able to walk with no difficulties. Her Romberg was appropriate. She was not dizzy or swaying with her eyes closed. Spinal alignment was free of lordosis, kyphosis, and scoliosis. She had a nice straight spine. Lower limb range of motion was intact. She was able to rotate, extend, and move easily. I am just going to thank the patient. Is there anything I can do for you before I leave?
No.
All right, thank you so much, and I'm going to go document.
Thank you.